Good afternoon. I'm Scott Harrow with the UMHS Alumni Association, and today we're speaking with Dr. Adham Osman, a 2015 graduate. And Dr. Osman, can you tell us a little bit about where you're currently working?
Hey, Scott. Sure. So I'm working at AdventHealth Orlando. I'm working in the advanced cardiac surgery unit there as an intensivist.
Okay. And for the people out there that don't know, what exactly is an intensivist?
Great question. So an intensivist is basically a specialist in critical care. We are tasked with dealing with the sickest patients in the hospital, patients that are classically considered to be crashing. If you've ever seen, the movies or TV shows when they call it code blue overhead and somebody's heart or lungs have stopped working, they typically call the ICU team. We respond to those calls and try to revive and resuscitate patients who are otherwise dying. Um, and we try to stabilize them and reverse any causes that we can to get them back to health if possible.
Well, so that sounds like a really important job. And could you just off the top of your head, I know it's probably not typical, but what would a typical work day be like for you, a day in the life of your job?
Yeah. So I kind of described what the life is of a kind of a general intensivist.
Hmm.
General intensivist would take kind of all comers in terms of kind of very sick patients. I work in a kind of a specialized ICU called the Advanced Cardiac Surgery Unit. And in that ICU, we typically specialize in patients who have primary cardiac problems, pulmonary problems,
Right.
patients who are so sick that they require devices called ECMO or what we call extracorporeal membrane oxygenation. Um, Kind of a long-winded answer, but it's basically a device, as we were kind of talking briefly before the interview, but it's a device that basically pulls blood out of the body, oxygenates, and pumps blood back into their body to take over the role of the heart and lungs when their own heart and lungs are too weak to do so. So we will place some of these patients on these devices to try to keep them alive in order to reverse any potential reversible causes and support them in the meantime. Hopefully, in those cases, if we can reverse those causes, we can take them off the machines and hopefully get them back to health. Now, there are some scenarios where these patients their heart and the lungs are so sick, they're unable to recover effectively. And in those cases, the unit, the department that I work in also does heart and lung transplants.
Hmm.
So we work in conjunction with our cardiothoracic surgery colleagues. We work with our heart failure cardiology specialists as well. And together as a team, we work to try to get transplants for some of these patients as well. So we have kind of a diverse patient population. I would say the sickest of the sick typically come to our ICU. We get referrals from all over the state of Florida, and actually, we get referrals from other places in the southeastern United States as well. But it's definitely an exciting place to be. Love working there, and I love the people I work with. It's definitely there's definitely a huge emphasis on teamwork there.
Oh yeah, definitely. And it sounds like so the ECMO, is that in layman's terms, is that like a ventilator, basically?
So it's similar. So in some ways, it is different than a ventilator. A
Hmm.
ventilator is kind of a breathing tube that helps oxygenate the
Right,
lungs,
right.
and we use that in a lot of different ICUs.
Sure.
There are some situations where the lungs are so sick, so damaged that even a ventilated person. In that case, we would use ECMO, where we physically take the blood out of the body, we
Right.
oxygenate it outside of the body, and then return it back into the patient.
Wow. So these patients are very, very sick, it sounds like. So like it's really life or death situations, it sounds like.
They really toe the line, I would say.
Wow. And just on a lighter note, can you just tell us a little bit why you chose UMHS for a med school?
Absolutely. So, after I I actually originally was studying philosophy in undergraduate. I wasn't sure what I wanted to do,
Right.
when I finished everything. So I ended up doing my last year abroad in Europe. And when I was in Spain, I actually ended up meeting some professors who did research in neuroscience. Worked
Hmm.
with them, really enjoyed it. I love learning about the body, but I figured, I want to try to, I enjoy learning about the body, but want to be able to work with others more often, like work with people more closely. So I figured medicine would be the way to go. Went back, did my post-bac pre-med classes and my MCAT. And I was really looking for a school that would really have a lot of accessibility of the professors, and would also, had kind of good reviews in terms of patient experience. So I had a friend who actually was going to the Ross vet school, veterinary school. He was actually my best friend from college.
Hmm.
And he had heard about UMHS and actually was friends with several people there. They told him and gave him really feedback about good support from the professors, great student population, and kind of heavy emphasis on teamwork, right? So a lot of the students would stay after classes, they would study together, they had their study groups, and it really seemed like an environment that was my values and what I was looking for. And it turned out to work very well.
Okay, great. And what advice would you have for current or prospective UMH students thinking about going into your particular specialty or just going into specialties in general? What advice would you give them?
I think the first bit of advice I would say is, make sure that you enjoy the road. The road in medicine can be long at times, but I think that it's really important to enjoy yourself in the process. We really worked hard. My classmates and I, we had a study group, and we would study together every day, after classes. But we always had a specific time every week where we would go to the beach and play volleyball, or go out to dinner or have fun, and really have that kind of balance.
Right.
And I think that definitely that carried over into residency, fellowship, and even now in the ICU that I work in. Just, it's life or death where I work, but I love the people I work with, and I love the patients and the families, and I think it's very rewarding. And I think that, it's important to enjoy what you're doing, um, and not to lose sight of that. Also, other piece of advice, when starting school, or even preparing for med school, find a good study group. It's a family, it's a group effort, and I think you'll always be better when you work with others. That's what we did, and I really value the time that I had at UMHS.
Okay, wonderful. And is there anything else that you'd like to add that we haven't covered today?
Uh, no, I think I just think that it's nice to be able to touch base with you guys. I know that I've met a couple of your colleagues when they visited universities in the area, and it was nice to be able to talk about my experience there at UMHS, and kind of how I navigated school and residency, fellowship, and early career. I know that that's something that I would value too as a student, because when you start school, when you start at med school in particular, it can be a little overwhelming at times. There's so much unknown. There's so many steps to take, but hearing people talk about their experiences, I think is very helpful. So I appreciate the opportunity to kind of just explain my experience and how I did it. And hopefully that can help others that are coming into the classes this semester and the coming semesters.
Okay, great. All right. Anything else that you want to add?
No, I don't think so. I think we covered it.
Okay, great. All right. Well, Dr. Osman, I want to thank you so much for your time and have a great day. Okay.
Thanks. You
All
too.
right. Thanks. Take care again. Okay. And Dr. Osman, can you just tell us a little bit about yourself? Where did you grow up? And did you always want to be a doctor?
Sure. Good question. So I was originally born in Honolulu, Hawaii. I lived there for until I was about 3 years old. Moved around a bit, but mainly grew up in Boston.
Hmm.
That was where I spent most of my time. In terms of what I wanted to do with my life, I we kind of touched on this a little bit already,
Yeah,
but
sure.
uh, I studied philosophy in undergraduate and really wasn't sure what path I was going to take. Honestly, I did a year abroad in my last year, and that was definitely a great experience. But when I was abroad, I ended up meeting professors in Cadiz, Spain, a small city in the south of Spain, and they were doing research in neuroscience. I worked with them, really enjoyed it, loved learning about the body, but figured that I wanted to do something where I would be able to deal with people more consistently. I love working with people. And so I felt that that would be more consistent with my values rather than being in a laboratory. So went back to Boston, did my post-baccalaureate pre-med classes, took all the prerequisites, prepared for the MCAT exam, and started looking for schools. And I'm lucky to say that I was able to choose UMHS, and the UMHS was able to really help me really help shape my medical career. Um, my father is a physician, and I think that he at times growing up would mention that I saw what he did. I really
Right.
was, I was really interested and always kind of impressed with the cases that he would talk to me about. He never really pushed me too hard, though. He really wanted me to make my own decision. And I felt like the fact that I was able to make my own decision, albeit in a roundabout way, really made my choice kind of more sincere and special for me.
Okay. And I may have asked you this already, but where did you do your undergrad? Was that in Hawaii?
No, so I did my undergrad at University of Massachusetts at
Okay.
Amherst.
Okay,
Yeah,
advanced.
it's about an hour and a half west of Boston.
Okay, great. And what do you like the most about being an intensivist as a medical specialty? I mean, what are some of the most rewarding things? Obviously, it sounds like you're really helping save lives when people are really, really sick.
Trying to.
Yeah,
I think the most rewarding part is kind of as I mentioned, the teamwork. I feel that the ICU is definitely a place where the principles of teamwork and working with others is probably heightened the most.
right.
I grew up playing sports. I love playing sports. I grew up playing basketball in
Hmm.
particular. I actually ended up actually played basketball at UMass or for UMass. And I think that those values of working with others, trying to figure out each other's strengths, weaknesses, trying to find out where everybody kind of fit and the team approach, and working on meaningful problems, complex life or death problems here is really rewarding for me. I love it.
Okay. And what are some of the just off the top of your head, what are some of are there any like medical breakthroughs or anything exciting in your particular field that you'd like to talk about?
Yeah. So I mentioned this a little bit already, but we do heart and lung transplants
Mhm.
in our ICU in conjunction with the cardiothoracic surgery team and advanced heart failure cardiology team. And I think that the process of helping others who are otherwise dying and kind of going through the spectrum of this critical illness, life or death, to stability, to evaluation, to decision, to transplant, to recovery, to potentially living a life again with loved ones and family. That spectrum, which consists of highs and lows, of course, is really special for me. I know that that's something that is really meaningful for me and the team that I work with, and I feel that that experience really helps me appreciate things in my own life. My own health, well-being, the people that I love and care about, being able to go home and have a good meal with my wife, and being able to, talk to my parents or my family or friends, it's it really kind of sheds a lot of light into the things that I have and the things that we all kind of share. So
Sure. I'm just curious, and this is something I didn't have in the questions, but just curious to ask. I would imagine that you have like I said, you try to save as many lives as possible, but I would imagine there's also an element of the people that don't make it. How is that as a doctor? How do you deal with that?
yeah, so that's really difficult. That's exactly right. We try to save and help people that we can, but because we're dealing with such sick and
Yeah,
complex patients, there are a lot of people that unfortunately don't make it or don't
right.
turn out the way that we would otherwise hope. I think again, the thing that I've learned in that process is being able to talk about it.
Sure.
So
Yeah.
really talking about it with my colleagues, talking about it with my wife, my father, who's a physician, my friends who I really trust, um, being able to process these things and not keep it inside.
Right.
That is definitely something that I've learned in my training, but I think that it's particularly enhanced now in my job now because uh, just because of the complexity and severity of illness. Just something to add that's kind of relevant to what you're asking. I'm also am on the ethics committee
Hmm.
of our hospital, and the ethics committee is composed of physicians, um, and then our law team, like our risk team, which is composed of lawyers, social workers, nurses, a whole different group of people from different backgrounds, and basically the ethics committee is tasked or we're consulted when there are complex ethical cases in the hospital, not just in our ICU, but all over. We actually are in our hospital is one of the biggest hospitals in the country.
Hmm.
And we have a lot of satellite hospitals as well. So anytime there's a scenario or situation where, there's a disagreement of, let's say, the family or the patient between them and the healthcare professionals, or where it's just not clear how, a particular situation should go, they'll consult us, and we're able to kind of weigh in about kind of the ethical principles of medicine and seeing how we can apply the best care and guidance for those cases. And a lot of those cases are also life and death.
Oh, yeah.
Maybe there's a person who, we recently had a case where, there was an elderly woman who uh, basically lived alone, didn't have family, was an orphan herself, never
Hmm.
married, no children. Now in the hospital with a terrible brain infection,
Hmm.
wasn't able to make her own medical decisions. And really, there was a question of, hey, do we put a tracheostomy tube, a feeding tube? Do we continue to take care of her? Is that really a compassionate, ethical thing to do? And so they consulted us. We were able to work with the social workers who were
Hmm.
kind of like a legal proxy to her care. After we kind of investigated, trying to talk to her friends, trying to dig up any type of will or any type of legal documents that might have specified her values, we were able as a team, again, as kind of a team approach, to figure that she really wouldn't want to be on machines and be kept
Right.
alive artificially. And we were able to make a decision for her on her behalf, to try to do the best thing for her, uh, in the event that she wasn't able to advocate for herself. So that was rewarding, and it also kind of adds another layer to the work that I do and the work that we do at the hospital.
Yeah, I think that's a very important issue. Um, we have something similar in New York State. We have what healthcare proxy, and it's very important that people, say what they want done. If God forbid, something happens where they're on life support, do they want to be on it? Or,
Yeah.
and I know that's something people generally don't like to talk about, but I think it's really important for everybody to have that
Oh,
information, ready in case, the worst happens.
I
Um,
couldn't agree more. I
yeah.
couldn't agree more.
So, and do you have any experience or, this is something I know, a lot of alumni that I speak to struggle with. Are you ever the one that has to tell the family that, the bad news, somebody's not going to make it or that sort of thing?
Absolutely. Yeah. Unfortunately, uh, it's one of the hardest parts of what we do.
Sure.
When things are not working well, when patients are not doing well, we need to communicate that to the family. Uh, I love giving good news. When things are happening, when if we're able to save somebody, that's one of the best feelings in the world, to
Sure.
be able to walk in the room and be like, all right, your mom's coming home. Christmas is on this year. Like that's
Yeah.
awesome. But on the flip side of that, it doesn't always work out that way. And having to sit down and have meaningful discussions about kind of end of life decisions, or just being open and honest about the fact that a loved one is dying and is probably not going to make it
Right.
is difficult. It's interesting. And when I was training in residency and fellowship, we always had these workshops, and there are textbooks about how to break difficult information to patients and families. And through reading these things and through going through these workshops and training, the things I learned are that it's actually very simple. Um, there's these principles, and yes, I think maybe with time and work, we internalize the principles.
Yeah.
But at the end of the day, I think about it in terms of, what if my mom or dad was in that bed?
Yeah.
What would I want to hear? What if I was in bed? What would I want to hear? And the number one thing that I am looking for in a care team is that they care,
Yeah. Of
first and
course.
foremost, and everything else after that we can talk about. But I want to know that they genuinely and truly care about me and my loved ones. And I think that that's kind of how I walk into it. So I sit down with them, and I talk to them as people. And it doesn't mean that it's always easy. There's highs and lows. There's definitely a lot of tears, but sometimes the most effective communication is nonverbal, and just being there and showing them that, hey,
Sure.
this person, your mother, is an amazing person, and we genuinely care about her so much, and I know you do too, and I'm here for you just as much as I am for her. I think that that's kind of the mentality that I use, and that I've been, that a lot of my partners use, and that's just part of the job.
Yeah, I think that's very important, and I'm sure you're great at it, and I'm sure that the families would also appreciate your honesty as well as caring. Um, it's not always what they want to hear, but the truth is, I think, great in these situations,
I
as hard
appreciate
as that
that.
is. Um, let's see. Is there anything that you'd like to say on a much lighter subject? Like to say to the UMHS alumni out there?
Uh, I would like to say that I'm proud of all of you guys. I have worked with a lot of, the alumni out there. These were like my classmates and family when I was in med school, and I know that you guys are out there doing great things. One thing that I would really appreciate, and that I would look to be more involved with in the future, is reconnecting with a lot of my classmates. I think that we scatter, and we are going to different hospitals and clinics, and we have different specialties and different kind of roles in life after med school. Some of my a lot of my friends, I keep in touch with, but I'm so interested and fascinated to know where a lot of other people have ended up. And if there was a network or some way that we could communicate with each other, I think it would be really great on a personal level, right? Because these are people that we've been through highs and lows together, and
Right.
we've helped each other out so much. And I want to uh, be there to share in their success, and be advocates for them. But even professionally, I mean, there are probably other UMHS alumni out there who are doing, similar things that I am. And sometimes, not sometimes, oftentimes we have questions, and we appreciate insight and perspective. And to know that I could be able to contact some of my trusted colleagues from our school would definitely be beneficial in many ways to me.
Okay, great. And Michelle Perez might have told you that we're working on a website that's we're hoping to launch within the next month. That's going to have a lot
Love it.
more, going to have a lot more information. We're going to have class notes. We're going to have events. So it's
That's
all
awesome.
good.
You should
Yeah.
just tell me. Yeah,
Yeah.
and I think that's such a great idea. I look forward
Yeah.
to that.
It's been a long time in the making and it's long overdue, but we're hoping it should be out in the next month or so. Is there anything else that you'd like to add that we haven't covered? Or any questions you have or
No, I mean, I think the only thing that I'd like to add is, if there are ever opportunities to, and I've talked to Michelle about this as
sure.
well, but if there are any other opportunities for like new students, prospective students,
Right.
people that have questions about what it's like to be a medical student, what it's like to be a clinical student, applying for residency, fellowship, and beyond. I am definitely I definitely like to be available to help because so many people have helped me along the way.
Okay, great. And I'm sure Michelle told you, like, we have many opportunities where you can help out with a fair. We also do live streams. I think you'd be great on a live stream.
Oh,
And we
I'd
do
love that.
we do compensate for those. So there's lots of opportunities. Just a couple things before I let you go. Would you be able to send me, do you have like a professional headshot that you could send me that I could use?
Yeah,
And
absolutely,
if you have any like other photos that I can use to illustrate the article, that would be awesome. Um,
absolutely.
and do you have, finally, do you have any objection, like you mentioned, is it best for students to, if prospective students want to reach you via email, or do you have a preferred way to be contacted?
Yeah, I can leave an email. I have like a professional
Hmm.
email that I have I can give to you guys, and I would definitely be happy to check that and be available to help other students that have any questions.
Okay, great. And what, just for housekeeping purposes, what title should I use for you, your official title?
I would say intensivist is my official title. MD intensivist. Yeah.
Mhm. At the hospital again,
And the hospital is Advent Health,
Advent Health.
and and then again the unit that I work in is the advanced cardiac surgery unit.
Advanced cardiac surgery unit. Okay. And just so you know, Adam, I'm going to have all this transcribed. I'm hoping I will get you something. I'm going to say realistically in the next week or two. Because I have a lot of
Yeah.
stuff that I'm dealing with, coming back from a long vacation.
No, I understand.
And yeah, and you have my do you have my cell if you ever did I give you my cell?
I don't know if I'm not sure if you included it in the email, but that'd be
Oh,
great to have.
yeah, 917 eight six
Hold on,
zero six. Yeah. And I can
let me.
email this all to you. It's not a
Yeah,
problem.
would you mind? That might be a little
Yeah.
easier.
I'll just email it to you. And do you have any questions?
No, I hope you had a good vacation.
Oh, I
You
did.
just came back from vacation?
Yeah, I did. I did. I was in Mexico. It was in Puerto Vallarta. It was great, but the last few days it
Oh,
was
wow.
kind of rainy, so it was easier to come back. But I'm in New York, so it's freezing here, but the winter's almost over. So
Uh, Hang in there. Yeah, hopefully it turns around soon.
yeah, it will. All right. Well, if there's nothing else, you've been a wonderful interview. I want to thank you so much for your time. And
Thank you.
I will get a draft to you probably in the next 10 days or so.
Awesome. And yeah, I'll send some photos your way
Excellent.
as well. And if you need
Yes.
anything else, let me know.
Excellent. All right. Well, thank you so much for your time. And I'll be in touch soon with the draft. Okay.
All right. Thanks.
All
Have a great
right.
day.
All right. Take care, Adam. Okay. All right. Take
Bye.
care. Bye.